Hi, everybody. My name is Lily. I'm a medical student here at Meharry Medical College, and I'll be presenting my research that I did at Stanford University with Dr. Mark Berry. Our project specifically was looking at the relationship of social determinants of health and disease severity. We all know that social determinants of health can have a big impact on patient outcomes, but the relationship between social determinants of health and disease severity is not well understood. So the objective of our project was to compare patients who had stage 1A non-small cell lung cancer to those who had a more advanced stage, like stage 3A non-small cell lung cancer, and to see if those in the more advanced cohort are more impacted by their social determinants of health or not. We hypothesized that the impact of social determinants of health would be greater in the more advanced group. In terms of methods, we use the National Cancer Database to look for patients between the years of 2004 and 2019 who had stage 1A or stage 3A non-small cell lung cancers. And then we then stratified patients as having positive or negative social determinants of health by looking at things like income level, education level, insurance status, so were these patients insured or not, as well as looking where the patients lived, more specifically if they lived in a rural area or not. We then looked at treatment and survival by doing logistic regression, Kaplan-Meier curves, as well as Cox proportional hazard analysis. In terms of results, so our first set of graphs is looking at the percentage of patients who got the definitive or appropriate treatment that they needed. And we can see that both in the early and the late stages, those percentages were qualitatively different when comparing the negative and the positive social determinant of health group. Having positive social or being in the positive social determinant of health group, those people were more likely to get their definitive treatment. And I know that 3 to 5% difference doesn't seem like a lot, but the absolute numbers can be significant when you consider that 250,000 people per year are diagnosed with lung cancer. And then moving on to our multivariable logistic regression. Basically, we were looking to see which variables were predictors for receiving definitive treatment. And as you can see in both the early and the late stage groups, having positive social determinants of health was a good predictor of getting definitive treatment. For the early group, being female and having comorbidities were also significant predictors of getting definitive treatment. Our next set of graphs show 5-year survival. And we saw that those with worse social determinants of health in both the early and the advanced group had a statistically significant lower survival rate. Specifically, the 5-year survival rate was significantly lower in the negative social determinant of health group for both cohorts. And the negative social determinant of health group is the red line, and the positive cohort is the blue line. And then finally, our Cox multivariable analysis, we were looking to see if social determinants of health is an independent predictor of survival. So in multivariable Cox analysis, the impact of social determinants of health was qualitatively similar, but social determinants of health had an independent association with survival, even when considering other factors known to be associated with survival. The discussion tab that I have here just goes over the findings that I went over for the results, but our main conclusions and takeaways are that social determinants of health has similar impacts on non-small cell lung cancer treatment and outcomes in both early and more advanced stages. So unlike what we thought that the late group would be more impacted by their social determinants of health, it actually seems to be pretty it seems to be relatively similar in how social determinants of health impact disease, whether they're early in their disease progression or later. And then where do we go from here? So it'd be really important to have more efforts to help mitigate social determinants of health. and the effects that they have on patients. And then this must include all patients and cannot be focused on disease severity. This concludes my presentation. Thank you.